At this week's City Council meeting, the Lubbock Health Department gave an in-depth brief to the council over many things, such as emergency preparedness, disease surveillance, and of course, the measles outbreak.
Another thing mentioned was the health department's budget and a crucial grant that they say hasn't been increased in 20 years. KLBK's Maddie Powers is here with us, and Maddie, this grant in particular is a pretty important one, especially right now, huh?
That's right, Matt. Right now, the health department receives about 27 different grants. One of them is the immunization grant, which is a federal state matching grant, meaning they both contribute to that, allowing the department to provide immunization services, basically educating people about immunizations. But the director of public health tells me that additional funding hasn't been given in 20 years.
We all get an immunization grant, but the amount of money that the local health departments are receiving hasn't increased.
Within the Lubbock Health Department's budget, the immunization grant holds about $254,000, using that money for educational outreach.
The grant is for our staffing, supplies, advertising, being able to go out to health fairs or doctor's offices and visit and talk about the importance of vaccine.
At the Lubbock City Council meeting, Wells highlighted the need for raising that grant budget that has stayed the same for 2 decades.
It's been $254,000. That was a lot of money 20 years ago when we got it, and that is not a lot of money now when you're looking at the cost of hiring nurses and overhead.
Especially amidst the measles outbreak in the state.
So the state's given us free MMR vaccine. The measles outbreak's hard to predict, so I don't know exactly what we're going to be needing in the future, but we will probably need an increase in staffing, and hopefully the state will come through and assist with that.
And they need that money because, like everyone else, they're dealing with higher prices from inflation.
So one of our big asks this year is, can we start work to increase that so that we can have more capacity at the local level to respond to things like measles.
Wells says this isn't just a Lubbock problem, but about 60 other health departments across the state are also needing an increase of funding.
Maddie, thanks so much.